So then another principle is buoyancy. And buoyancy has an upward thrust in the opposite direction to the pull of gravity. So basically gravity pulls down, buoyancy pushes up. And our body's center of buoyancy is at the base of the lungs. And the more immersed in the water you are, the more buoyant you become. So the deeper you go, also you get more compression in your lungs. The more buoyant you are. Increased buoyancy causes a decrease in weight bearing and compression into joints with less impact on your joints. So if you're thinking of your clients who's got arthritis and even the jarring of walking can sometimes be too much for them, in the water that is hugely decreased. And the other effect that you also get, which is a bit more from the hydrostatic pressure, but it's like you're wearing a compression stocking or a brace around your joints, because you're getting pressure on it from all directions the whole time without any restriction in movement. So here's an example or a couple of examples of how we can use a piece of equipment like the pool noodle to create a total different exercise or effect on the body. So if we look at the picture on the bottom left, at somebody in a seated position with a noodle hanging under their shoulders. So in that posture, you have to get quite a lot of shoulder depression. So activating your lats, and you have to be quite strong in your core and your abdomen to keep that position. But the beauty of this as well is that it's like sitting on an unstable surface. So like on a ball or a wobble board or something that isn't solid. So you're constantly having to make micro adjustments to maintain your balance. So what we often see when we have people in this position at the bottom is that they're either really hunched over or they can't get their pelvis directly underneath their shoulders. So they'll either be leaning forwards, which then throws their legs back and they lose their balance that way, or they're leaning too far back when then throws their feet forwards, which throws them even further over. So it's really a nice way of getting the full body to participate in retraining balance. So that would be our first starting point. This is the easiest to do. Then the second level would be sitting on the noodle. So now you have to control still a lot of your upper body movement and where your feet are. And this most people find very difficult to get the correct balance between quads and hamstrings. They either have their feet too far forward, so quads are working too hard, or they have their feet too far back, and that then causes them to fall over. And most people learn this within 2-3 minutes. They find that balance without too much intervention from the therapist. When people are really got very poor balance and sense of writing reactions, then the therapist would stand in front of them and holding their feet and their knees, and sometimes even the pelvis, to try and get a little bit of side flexion. We practice a lot of tipping so that people can feel how it feels when they're off balance, and then that makes it easier to find the center. And then another example is just in that seated position, then to push the noodle down. This is much harder because now you're stabilizing just through your shoulders. So your shoulder, dynamic shoulder position needs to be, or dynamic shoulder stabilization needs to be pretty good to get this right. But most people get that after a couple of falling overs. Okay. So next we can look at hydrostatic pressure, which basically means water. So the deeper you go, the more the pressure is. So in this picture on the side, the foot and the calf will have most pressure, and then obviously less pressure higher up. And that then has a big effect on the amount of blood that's sent back to your heart. So we'll have a look at that a little bit later. Also, the increased blood flow helps with the removal of toxins. So it is a cleansing system or effect that's happening in the body. I remember one of my clients, she did a aqua class, and for 3 days afterwards, she felt like she's run a marathon. She eventually had to take anti-inflammatories to get rid of the detox effect. It's not quite what we were aiming for, but it's still, that normally happens the first, maybe the second time that they come into the water, depending on how overloaded their toxin levels are. Then also the hydrostatic pressure puts quite a bit of extra pressure onto the chest, which means people have to breathe or use a lot more muscle to breathe against resistance, but it doesn't feel like you can't breathe. So it's any other way that we try and strengthen intercostals other than breathing out through resistance is too constricting. So if you think of putting a TheraBand around your chest, if you breathe against that, that will help to strengthen, but it also feels very restricting. So in the water, we can already see there's quite a lot of positive effects on our body just by being in the water without even exercising. Then if we look at turbulence, the movement through water can be streamlined or turbulent, again, depending on the shape, the size, and the speed of the object moving through the water. So if we look at this picture at the bottom, this lady, so that I can be hands off with her, and what we're doing is isometric hamstring and quad resisted movement. So her left knee is flexed at 90 degrees, and she is holding that still. I'm pushing her towards her head and pulling her towards her feet. So if we have a look here at her arms, so her left arm, she is pulling down against the resistance, and that is creating turbulence on this side. On the right side, she is pushing up. So that's also part of her compensation pattern of trying to activate her left hamstring. I think we're busy working on there, looking at my hand in the movement. So in order for her to activate her left hamstring, she is using her left lats, whereas we're aiming for her to lie with her arms straight out in the water. So this gives me also already a lot of ideas around treatment and where weaknesses are and where the muscle imbalances are. So the pressure during turbulence increases in front of the moving body. So that's what gives us a very nice idea here. Below her arm, there's a lot of movement in the water. That's the increase in turbulence. And then behind the part that's being moved, that is the decrease in turbulence. And then we can use turbulence as its quality of the water that we use a lot. So depending on what we want to do, if I've got somebody that is struggling with shoulder abduction, I will, to assist the movement, I will use turbulence to pull them towards their feet, which will then help their arms to open up. So the water will almost drag their arms up. Same for the opposite direction. If I want turbulence to assist the movement, I'll push them towards their head in this supine position. If I want to change that around, then I will, when I move them towards their head and they stretch their arms up, now they have to work against the water pushing down on them. And when I want to move them, create resistance moving downwards, then we pull them towards their feet. So there's a lot of thinking going on in what do I want to achieve, but I can also change it very, very quickly. And sometimes it takes a couple of moments just to go, okay, what do I want? And then to try and translate it to the client, and then to physically coordinate it all, because they have to do the same time that I'm doing. And yeah, ends up in a lot of laughter and fun. So yeah, as we said, turbulence can be used to affect resistance, balance, and stability in the water. Another way that we use turbulence in the water is if somebody is standing, say standing on one leg in the water. And then if you take your hand and you move it in the water behind them, you can use turbulence to pull them towards you. And then they have to resist that. Or I can try and, by moving my hand fast, I can create resistance in the water and turbulence in the water, pushing them away. So I don't have to change my position in order to get somebody to give them more of a challenge laterally versus posteriorly versus anteriorly. I can just change what I'm doing with my hands, which is quite nice. And then from the tactile perspective, because you constantly have water all around your body, there's a lot of tactile awareness that's being that somebody goes through in the water. And also when we facilitating and making changes to how somebody is moving, there's a lot of touching and just facilitating. So that also helps to increase the tactile input. All right, then thermal conductivity. A warm therapeutic pool, the temperatures are, or the temperature of warm water is less viscous and easier to move through than cold water. So the temperature of the water, colder is more viscous, hotter is less viscous. And movement in water increases the heat transfer out of the body. So we get hotter faster when we're in water. And water transfers heat 25 times faster than air. So in a very warm pool, there isn't enough of a temperature gradient for the body's heat to dissipate during vigorous exercise. So that's something that we have to really pay attention to, especially when we use our pools for more than one purpose. So if we're doing groups and we're doing intense workouts, if the water is warmer, we have to decrease that intensity and also add more frequent breaks and have people drink more water during a session, just to make up for this temperature gradient. Warm water also promotes improved circulation and blood flow, which will then help to reduce pain, encourage relaxation, and improve muscle activity, elasticity. So some of the effects, there's a lot more. I only highlighted a couple. Effects of immersion is that there's an increase in blood volume, and that is from the effect of the hydrostatic pressure that's sending more blood back into the heart, and also the buoyancy. So a lot of our swelling comes from gravity. So we all know, especially when we've had an injury, like if you had an injury on your finger or your foot, having it in a dependent position makes it throb really quickly and increases the swelling. So a lot of this increase in the blood volume comes from the fact that this buoyancy that's pushing the blood back up again together with the pressure. The cardiac volume increases by 27 to 30%, leading to a stronger heart muscle contraction. So the heart muscle is fuller, so it can contract stronger, according to Starling's law, where stretched muscle contracts stronger. And the cardiac volume is increased by 35%. So again, a lot of changes in the vascular system that we're getting just from being in the water. Whether it's warm water, cold water, doesn't matter. It's the effects of the buoyancy and the hydrostatic pressure. There's also a decrease in local edema, in nerve conduction velocity, in muscle spasm, and blood viscosity. So there's more plasma that's coming back to the blood from the interstitial spaces. So it was really interesting. One of my clients, she's had lymphedema in her one leg for a lot of years, so 6 to 8 years, wearing her compression stocking, and she thought that she was at a stage where she's reached the best that she's going to be. Then she joined our aqua classes, which she does twice a week. And after about 3 to 4 weeks, she needed to go for an adjustment on a compression stocking because it was too big. It was not giving her enough compression. So that was a really nice practical example of this local edema and the changes in the lymph. And the interesting thing about that is that it lasted. So it had a build-up effect, that from 1 week to the next, there was more lymph being taken away. So the vital capacity decreases by 10%, and the work of breathing increases by 60%. So there's definitely, we have to be careful with people who have got diminished lung function, and it has to be quite severely diminished for them to feel it. But it has a great strengthening effect. Also, the buoyancy helps to rehydrate the intervertebral discs. So there's less pressure on the nerves. There's the same effect of what we have after sleeping, being horizontal for 8 hours. Our discs reabsorb the fluid. So that happens in the water. And then on the skin, it makes skin more fragile and soft. So especially when we're working with people in their later years, who has already a lot of thinning of the skin, we have to be quite careful when we dry, and also so that we pat them dry, or they pat themselves dry, rather than rubbing on the skin. And also as therapists, we have to be very careful with jewelry. So all jewelry must come off when we're in the water. And then a very interesting fact is the warmth of the water blocks nociception by acting on the thermal receptors and the mechanoreceptors. So we have a lot of effect from that level as well. In some of the psychological effects is in the water, there's a lot of rapport building. The therapist needs to be very aware as they bring people into the water, especially for the first time, and finding out beforehand if there has been any trauma around water. If you think of near drownings, family members drowning, sometimes there's a lot of fear around water. And that's not to say that you can't bring somebody into the water, but you just need to manage that and take it even slower. So the ability to move in water, especially for people who's injured and who can't fully weight bear, or somebody with a spinal cord injury, somebody with a stroke, the ability to move in water gives them much, much higher levels of self-efficacy. So that ability of, oh, I can try this. And people start trying things without noticing that they are. But just by trying to balance in the water, you're already recruiting so much muscle and cognitive space as well. Endorphins always a great side effect of exercise, being our natural analgesic and antidepressant. And as we all know, exercise helps to relieve anxiety levels. And very often people are able to do a lot more than what they thought they would be able to do. So one of my favorite things is when somebody comes into the water and they can't sit on the noodle, and I have to hold them in so many different places. And then 2-3 minutes later, their bodies have figured it out and I can let go and they're independent on the noodle. And the interesting fact is that it doesn't take very long for that to happen. It's really within minutes for most people. The seeing of progress, so from how difficult it was in the beginning to how quickly they get it right, boosts the self-confidence, and there's a decrease in helplessness. People really feel that they're able to do more things, and they also very quickly then start, like I often ask, do you want to do something easy or shall we make it more difficult? And they most of the time choose the more difficult. So people do like to challenge themselves as well. Okay, so some of the clinical applications is, what we achieve in the water is increase in mobility and flexibility through all those things that we've already mentioned. I've just spent 3 hours in the pool and I can still feel the effect of the elastic feeling in my muscles, skin, and fascia. And whenever I've done a training session in the water, I can feel my stability, and also like when I drive home after a class, I can feel it so much easier to control myself against gravity, and often feel taller. So just that idea of the spinal muscles also releasing and the spine being able to straighten out a bit more. We get a lot of pain modulation and relief. There's a decrease in spasticity and tone, and trauma and emotional release and support is something that happens quite a lot. So even without having any training in trauma or psychotherapy, just being in the water, people already feel a lot more held. And very often they either burst out in tears, the people that's been holding a lot, or they start sharing a lot more of their deeper stories. And that comes from that feeling of being held in the water. That's something that comes up really often. There's also a lot of improvement in movement patterns, and we'll use various techniques to achieve what we want. Today I had a really nice experience of a 9-year-old girl who has got cerebral palsy and very athetoid movement. For the last couple of weeks, we've put her in the noodle behind her back and tied a knot in the front, and let her balance in, because she can't move independently on land. So for her to be independent, moving in the water is great freedom. And then I used a floating device, which is just a strip of rubber with Velcro on it, and I put it around her ribs, her lower ribs. And it was quite profound to see how instantaneously she felt the difference, because she immediately had access to her obliques, which she doesn't normally have. And her movement improved significantly. She could start using her arms stayed more in front, and she could really play with her sisters who were also in the water. And when I asked her if I can take it off, she said no. Whereas everything else I've done was like, you can take it off, thank you very much. And then I sneakily took it off to see if she was going to notice. And she immediately turned around to me and said, no, put it back on, which was great to see how she felt the difference in her movement and her ability. So that's just by improving the movement pattern and abilities. Improved immune system function. There's a lot of changes that happens in the immune system itself as well, partly because of the detox, but there's other changes as well. Decrease in anxiety and depression, we see a lot, and that comes huge, mainly from the changes in exercise, the physical ability as well. We will, for somebody like that, we will do the assessment on land, and we'll start off with a short session. I normally start off with breathing exercises. So doing that in the water as well, people are already a lot more aware of their breath, where they're holding, where they're able to breathe in, where it's struggling to come in. So length of time can be anything from 10, 20 minutes. Most of our sessions are 45 minutes long, and we will then grade that according to doing a little bit of relaxation work. You can see on the photos that's currently up, we've got a lot of different positions that we can do some soft tissue work in, or we just do relaxation work. That depends on what level they're at. So if they're still experiencing pain with seeing movement, so the mirror neurons are still firing quite strongly, then we'll move very slowly with them as well. Most of them respond well. So the pressure of the water, I have not had anybody that has had a problem with that. The movement will move slower through the water as well, because obviously it's a lot of sensation that's happening during that time. Yeah. So we'll start them off very slow. If it's their hand that is affected, you'll bring it in the water slowly. And then the movement you'll keep really slow, and then obviously depending on what equipment you're using. So you can grade it and work according to where they're at in the cycle. So WATSU is the abbreviation, or that's where it originated from, of water Shihatsu. And it was developed in the 80s by a guy called Harold Dahl. He has since passed away. And he was up in the Harbor Hot Springs in California teaching his Zen Shiatsu students. And they then went into the water, the warm water, and played around with how to bring the Shiatsu stretches into the water. And from there, it developed into a beautiful treatment technique. And Peggy Schudinger is a physiotherapist and also trained psychologist from America. And she did the WATSU courses and just realized how much this would benefit our population of people that we're working with, people with pain, people with neurological conditions. And she then made it a lot more suitable and acceptable for the rehabilitation therapist, and also in a lot of hospitals and clinics. So WATSU is a one-on-one treatment technique, and it's a passive form of aquatic body work. It's done in chest deep water between, not really 32, it's more 34 to 35 degrees, because the body is calming down and really relaxing, so there isn't much of the temperature difference that we want to achieve here. It's slow, rhythmic, gliding, flowing movements. And because we're in the water, every little movement we do affects the body as a whole. If you think of lying on a massage table, if you do any movement there, or even doing exercises on the floor, there's constantly a part of your body that's being held down by gravity. And that stops the movement in that portion of the body. So in the water, your whole system is moving, all the fascia is moving, and it can do so in a very free manner. And the effects of the autonomic nervous system is that it brings about more of the parasympathetic dominance, which helps to relax us to a very, very deep level. So very often when somebody has had a 45-minute WATSU session, you'll see their eyes open and they look like they've been sleeping for a year. So the effects of treatment is there's an increase in respiration volume, so we get a bigger breath, and a decrease in respiration rate. Then there's an increase in the stroke volume, there's a decrease in muscle tension, tone, and spasticity. So this works really well for our high tone stroke patients and our CP children. There's an increase in mobility, range of motion, and flexibility. There's an increase in lymph drainage. There's a big effect on sleep and digestion as well. So this is a good treatment modality for our chronic pain patients and patients with fibromyalgia because it addresses the autonomic nervous system. And then I wanted to show you just this one example of what we did in action with one of our clients. So we got to sit on a noodle and then push the noodle down. She has had no other experience in the water, so this was her first time. So I found it very difficult. Her balancing strategy was to brace, to protract her shoulders forwards, to flex her body, and you can see how much tension she's got in her jaw there. Then we started with just a couple of manual and verbal cues to get her upper body in the correct position and to get a center of gravity over a center of buoyancy. So this was within a couple of moments that she got that positioning correct and everything in line, which then makes balance really easy. And there she got the position. So as soon as she found the position, she could feel it, and the effort that it required was so much less. So it's also a very nice way for people to get that idea of, if my muscles are stronger, it's going to be easier for me to move in general life and in everything that I do. So if we then look back at this image, we can see that during a hydrotherapy session, there is a lot of these factors, if not all, that we can influence. And hydrotherapy is or our goal is to find the optimum challenge level to improve functional movement and balance in a fun and injury-safe environment for all levels of ability. And then that's just about our aqua classes. And this is our website if you guys want to find out anything more about the hydrotherapy or the WATSU. We'll be offering quite a few WATSU courses during this year and in the years to come. So you can get more information on there. So thank you very much.